Hello, and welcome to Pills and Bills. I am a practicing clinical pharmacist with a passion for teaching and an even bigger passion for paying off my crippling student debt. I did design this book on my own, The Top 200 Drugs Simplified, to help med, nursing, pharmacy students, and techs learn smarter. So let's grab a pencil, let's color, review, and make these drugs stick together. If you'd like to color along with me, this book is available on Amazon and TikTok Shop. Just search Top 200 Drugs Simplified. If you find this helpful and you want to support this series, tap like, share, or drop a comment. Every bit helps. And with that, let's begin. All right, so we are going to dive into quetiapine or Seroquel. This is an atypical antipsychotic, and I'm going to start by coloring in those letters blue to remind myself it's a calming, sedating agent. Our FDA-approved indications are schizophrenia, bipolar disorder, and an adjunct for depressive disorder. Seroquel can help treat both positive and negative symptoms of these disorders. Positive symptoms like hallucinations, delusions, and agitation can be improved via Seroquel's dopamine blockade, while it also has serotonin blockade that might help those negative symptoms like flat affect withdrawal and lack of motivation. Yes, you did see me highlight that she is indeed the queen of quiet. It's a way that you can help remember the uses, but also the effects of Seroquel. Okay, weight gain. Why does it happen? Seroquel blocks histamine and serotonin receptors, which normally help control appetite. So when they're blocked, hunger increases and your metabolism slows. Plus, the sedation piece leads to less movement, which all adds up to weight gain. Also, if you see me coloring outside of the lines, no, you didn't. Okay, yes, as we said, it's a very sedating agent. It strongly blocks histamine receptors, which are responsible for wakefulness. And so once those are blocked, the brain shifts into a calm, sleepy state, especially at low doses. Okay, let's flip over to warnings for a second. Seroquel can lower the seizure threshold because it alters dopamine and other neurotransmitter activity, so it makes the brain a little more excitable in people who are already at risk for that. The other warning being urinary retention issues. This happens due to Seroquel's anticholinergic effects, which relax the bladder muscle too much, making it harder to start or fully empty the bladder, especially in patients with enlarged prostates. Flipping back to side effects, we also see dry mouth due to anticholinergic effects and reduced saliva production. Patients may also complain of dizziness, as Seroquel blocks alpha-1 receptors in blood vessels, so sometimes that can cause dizziness or lightheadedness when standing. Seroquel also has a black box warning for suicidal ideation in adolescents. In young adults and teens, Seroquel can temporarily shift neurotransmitters involved in mood and regulation, and that might worsen depression before it improves, similar to some other antidepressants that have this same warning. And to wrap it up, good news. Most of these side effects are shared across the entire atypical antipsychotic